Now I request the chairpersons to take the charge and introduce our speaker, Dr. Ramachandran sir, to begin the session.
Now we have an eminent speaker, Dr. Ramachandran sir. I invite sir to deliver the lecture. Please sir.
Thank you so much. Respected chairpersons and the learned audience. At GWALIOR, if you hadn't done that, I wouldn't have had a chance to step into this musical city before the end of our journey. So thank you for that, and such a wonderful ambience and very good arrangements. I congratulate all the organizers and also IAP MEC for this great arrangement. Now coming to the topic, I am working as a professor of eminence. That means I have completed my tenure with the NMC. But whatever I have been observing in the past few years, especially after the advent of CBME, the changes which are occurring, I just try to share with you in some of these slides. Actually, I am not a policy maker. I am in the middle. Just like most of us, I'm in the faculty side, where we are expected to arrange and deliver the material to our stakeholders, the students. But I am playing the role, though it's something like a panel in dealing with this problem. Haven't we always wondered whether anybody is listening to our problems? If you probably go to start from the middle, the teachers will always feel that so many changes keep on coming. How are we able to implement all this? Is there somebody listening? Is there somebody really looking at our problems? Though we are going to do it, is there anybody who is actually looking into the practicality and the feasibility and how effectively we can do it? If you look at the student side, they may also have their own difficulties, their limitations, their problems. They may also feel that is anybody listening. And the top, if you go to the policy makers, they may also say that all these are done with very good intentions to improvement of the society, improvement of the public at large. Why our people are not doing it as effectively as what is envisaged? What is the problem? So everybody has problems, but they have to, each one has to talk to the other person, understand the problems, reconcile to the best way it is possible. So building bridges in pediatric education, where the stakeholders are there like policy, academia and practice. I'm going to talk about in this few topics. One is what is about this policy, academia and practice, what does it mean? And what is happening currently, what type of coordination or understanding or bridging is attempted currently. Then what are the gaps, in spite of the best efforts, what are all the defects, what are all the deficits, and what are the future, what can be done to improve it and for the future. The triad of policy, academia and practice is something like you want to build a house. You make the general whatever is required. You say I want a house not very close to the main road. I want it 2-story. I want a parking in the ground floor. I want this much area. I want this much material. I want the budget to be like this. You are like this. You are forming the policy. Then you call some people who will be able to put the blueprint. They are the middle level, the academia, the faculty. The academia, the ones who are actually going to execute it in the way which the policy has decided. So they have to form the blueprint, they have to form the curricula, they have to form the timelines, they have to form the assessment methods, they are the ones who are going to do it. And coming down, what should be done ultimately, and what is happening at the bedside or at the field level to the patient care, that is going to be the last part of it, which is the practice. whether it is actually making an impact in the practice. That is what we are going to look at. That is something like after you build the house, you go and live there, generally you realize that this could have been done this way. That problem could have been rectified this way. Or I should have arranged the ventilation this way. The house is never complete. Same way, education is never complete. You will always have scope for modifications, fine-tuning, various changes. So the policy is something like setting the goals, standards, and the frameworks, which is done by the National Medical Commission. And academia, what we are, the educational institutions, the teachers, make us. And they say that the curriculum should have all these things, and the goals should also, they define, saying that this is the general goal of the policy, the pediatric education. The institutional goals also should be like this, aligned with this. But it is top down. The academia are the one, we are the ones. We implement this, the competency-based medical education. We lay down the framework based on whatever the guidelines have been given. We form the timeline, assessment methods, and we choose various methods. That also we make the definite decision. What are all the types of education tools we have to use for building our house strongly and robustly. And lastly, the arena where the learning actually is going meeting the patient care, it comes into the last practice. Whatever the methods you have chosen, whatever the ideas you have, ultimately should get transformed to the patient care. In our case, the child care, the child welfare. So for that, also we require not only just teaching our students or asking our students to show some skills, verifying their skills. We also should actually periodically get the feedback from them whether they are understanding and handhold them continuously. So we should not be behaving like silos or the pillars who are unconnected. We have to be the bridges. We have to build the bridges so that our path becomes very clear and very clear whichever is going on these pillars would actually reach their ultimate destination effectively. So what is happening in the education policy? The education policy is already laid down by various agencies. For example, the classical various competencies which are laid down in 1997. Beautiful document, but due to various circumstances came into effect only in 2019. The first CBME curriculum batch started their medical education only in 2019. But we are periodically looking at it after the introduction of CBME. As late as 2024, we got some revisions. Whether these revisions are making an impact, whether they are useful, that we have to tell them as our faculty. We have to tell them our feedback. Coming to the PG education, the PG education as recently as 2022, the guidelines have been given for the PG education, headed by our Dr. Sandeep Levin. The various components of PG education were laid down and came out in the Gazette also in 2023. The National Education Policy, which lays down the education policy for all the systems of education, that came out with a document in 2000 stating that how much should be the duration, what should be the idea of duration and assessment of our education policy, especially related to healthcare education, and what should be the type of component, whether you have to teach only what is required for them or what the public requires. So they actually said that some idea should be available to the medical education, whichever they have got, about the other types of medical systems of health also should be available to them. And the emphasis was on the primary and secondary level, whether these people come out as a good healthcare providers. Now, you may say that there is hardly any interaction which is going on between NMC and the academia. It's not so. You can know that all these components of the curriculum, whichever the guidelines which are formed, the books which came out to help us in actually delivering these components of education. These are all formed by the medical teachers. Okay? For example, the ACCOM module. Various modules, you have about 8 to 10 modules. All these are formed by our own medical teachers. And this interactive form of NMC officials also takes place. The last one took place in 2024 at Delhi. And just not the CPE was released, they also gave some supporting system like the curriculum implementation support program, CASP, also was started in 2019, and many of the faculty got benefit of that. NMC also has not only the original policy and other things regarding the UGs and PGs are posted periodically. They also ask you to give your comments. Are they listening to these comments? Yes. We can look at the 2024 modification. Certain things like the requirement of the examiners, what are the qualifications are modified. Like this, the PG requirement of the thesis, their research also was modified. They need not do multiple things. They can just do one thing to get qualified to sit for the exam. So there is a listening also going on from the NMC side for the suggestions given by us. And it is also formalized the feedback. That is in the portal, it's available, where you can actually access this NMC website, where you can give your feedback. Recently, even regarding the mental health of our postgraduate students, the feedback has been called for. Still, what are the gaps in coordination? You can see that between the policy and academia, still not many of the things which are requested for the child health programs, like the child protection and various things like components of ACCOM taken place to whatever the extent the policies were laid down. For example, certain things like how we are going to test the ACCOM, how we are going to test the attitude of our students or the postgraduates. Still the assessment component is not addressed. These are the things. Though we talk about the formative assessment, there is a lot of gap in the formative assessment. The reasons may be multiple. The teacher inadequacy, or the number of teachers are not there in adequate numbers. The time constraints, there are so many things which come into play. So these have to be addressed. And coming to between the policy and practice, there is no feedback from actual practitioners or the people who are in the field, how they feel about the students who are coming out. Like in industry, they have a big stake, they are the stakeholders. They tell the engineering education what they want from the graduates. They have to incorporate periodically in the engineering education. Like this, our own practitioners, either in the city or the village areas or the middle level, they should be able to give us some feedback. That should be incorporated in our requirements. What is IAP doing? IAP is a big player. Please remember that even before the NMC came up with the competency-based medical education, IAP had IAP Education Center. I am talking about 2010 or even earlier than that. The initial postgraduate syllabus as well as what are the requirements actually came from IAP. I don't know how many of you remember. We didn't have any other things. The IAP was the one who was giving us syllabus, what are all the components we have to teach, what are all the components we have to actually incorporate, given by the practical methods which are required, what are all the textbooks which are recommended, actually came from IAP. IAP also took a lot of keen interest in education. What we are having now, the National Conference of Pediatric Education, was started by IAP. So this probably will be discussed in detail. The district residency program, I will skip this. The logbooks, the electronic logbooks, which is the order of the day. The leaves and attendances have been streamlined. The requirement for the final exam for postgraduate, we are finding that these actually help us in actually giving the very clear directions to our students. whether they are undergraduates or postgraduates. These are all helping us to make very clear, this is what is required, this is what you have to fulfill, this is how you are going to be actually asking back. Though everything is not robust, something is in place. What should we do in future? Between the policy and academia, probably a wider representation has to be given. Wider representation means probably the academia should be represented all across the country from all types of institutions. You should have a lot of importance to the institutions which are not that much well developed in rural areas, in outskirts, in less developed areas of the country, because they are the ones who will tell you what are the constraints in framing the policies, what are going to be the actual practical difficulties. That should be probably more importance, more representation to the women policy holders, policy makers, because they may probably bring a better perspective regarding the equity in the women and children's health. And between the academia and practice, the bedside monitoring, especially what is required, something like the 360-degree monitoring or the continuous monitoring, and the importance of formative assessment and feedback probably has to be emphasized, and we have to, we as academic persons, tell the NMC how we can actually implement it, okay, where we will get the time for all this. And lastly, the collaboration between the actual practitioners and bodies like IAP should be involved so that the policies actually framed on what is actually happening in the field level practice and what are the desired changes. And that should be something like a quality control and periodic assessment should definitely be there. It just happened in 2024. We are hopeful that this will keep on happening. So building bridges will bring about extremely good outcome among all the stakeholders, and that is the way forward for the well-being of every child in our country. Thank you so much for your patient listening. If there were any comments and inquiries, we'll
take forward, like Sir has taken all efforts to organize this national conference here in GWALIOR. I feel that in Madhya Pradesh also for this policy making, a lot of work is going on. And I feel that with more robust method, we can implement all these in our day-to-day teachings. Also, after application of this 2019 CPME, although we as teachers also are learning day by day how to take classes in new ways, in innovative ways. Now this aspect has been incorporated, that we try to have interactions with our students, we try to have feedback from them. All these things have come up only after implementation of this 2019. And I think we will be able to take education to next levels also in our medical field. Thank you so much.
Thank you, sir. Thank you very much for that excellent. This all is very good. All policy programs are good. But the way the number of seats are being increased, the quantity, we say you go from have a bedside mentoring, you have feedback system, you have 360-degree assessment, you have more of faculty supervision. How is that possible with so many number of students pouring in? You have 50 patients on one bed, 50 students on one bed. How can you do bedside mentoring on that? And then the quality. So I am highly critical of the policies because the quantity is taking a toll on the quality. That is number one. And too much of regulations, too much of strictness on medical teachers, that 8 to 5 business, biometric attendance and all. This is, I don't think this is, this has a place in the, I don't know whether, but personally I feel that it is all highly unjustified and not producing the quality. Now, we talk of competency-based education. Let's say competency-based. So, if you truly go into the meaning of the competency, we are not producing a doctor who is competent of handling a delivery or even writing a prescription for simple diarrhea after doing MBBS. That's why the government also knows that. That's why they are now equalizing jitna MBBS seats hai utna hi PG seat karo, because they know that after MBBS a person cannot reach a common person. So just a few critical comments. I don't know the answer, but that was in my mind. Very responsive.
producing students who are capable enough of reintegration. Who is at fault? The student, policy, program, where is the problem? You may answer.
I think the policy. It's a policy. It's a policy. The kind of and I have to go by what is said. So I think it is a policy only which is at fault.
I would like to endorse what Vishnuta sir has said. We are producing more certificates. There will be more number of doctors actually. So we are having more certificates now.
Absolutely, sir. Both from all the stakeholders. As far as the students are concerned, whatever there are a few papers I have seen, they feel things like logbook, they don't feel very happy about it. Even what we think is very good, like a small group discussions, they are not very happy about it. Exactly for the reasons which are told by Professor Piyush. Probably what is actually done should be done in the small group discussion is not possible because in the small group is 30 or 40. What is that small group? The bedside teaching is happening for 30 people. Well, the NMC says it should be 10, not exceeding 10. So this is the practical reality. This is the elephant in the room. Somebody has to point out. So who is going to point it out? Okay, this is the problem of overburdening, overloading the system, so that nobody is actually coming out with quality. We may be producing a lot of numbers, but there should be a way. I just want to know. Can I ask one question to sir about the current teachers like Dr. Gaur, Ajay Gaur, or somebody? How you give a feedback to NMC regarding your problems? You have a problem like you are not able to handle so much of this thing is there. Do you tell your medical education department in your institution, do they communicate to NMC or is there any way anybody communicates to NMC? They communicate us. Periodically we get it.
I just answer on their behalf. Nobody communicates to NMC.
Thank you, sir and ma'am. Now I request all of you, all the chairperson speakers, sir, to please proceed to the felicitation zone for their mementos.